Hello, everyone. Thank you for joining the Cassava Banter. This is our first episode for 2023, so yay for us. It's always amazing for us to come here and do this webinar because for us, it's sort of a way to speak to the community and, get feedback from you. Because, even the topic that we chose today was something that we had from feedback from the last webinar that we did. And, we're always looking forward to exploring more topics, topics that are very sensitive to people or relatable to the everyday person, right? As you know, this is Cassava Microinsurance. What we do here is insurance basically, and we try to help you sort of like protect the things that you love, things that you hold dear to your heart, and doing that by making you enjoy insurance, not just getting you to protect those things, but actually getting you to enjoy your life while you're protecting all of the things. My name is Sadie. I am the marketing manager for Cassava Microinsurance. If you've joined most of our webinars, I'm sure you see me. I'm either hosting or co-hosting, or trying to have conversations. So today's webinar is very special to me because this is a topic that is kind of, that I have a personal experience with. And that was why I was really excited to host this webinar. I have somebody here on the call that is going to be my co-host today. He's my guest, but again, my co-host, right? He's going to be the one taking us through this whole webinar for today. So my job here is basically to throw him questions, speak to him, get feedback from him. And as you know, our webinars are always very engaging. So please feel free to put your questions. If you have any questions, you can ask in the question and answer box, and we would either answer the question while the webinar is ongoing, or somebody would respond to you in the comment section. I was just trying to see if I can while away time while some more people join, but I think we have a good number now that we can start. Hello, Adeshegun. Please confirm that you can hear me.
Hi, Sadie. Good afternoon.
Good afternoon. How are you doing today?
Good.
Okay, great. We can't see your face though, so I'm sure
Okay,
most people.
One second. Sorry about that. I thought it was on already. Can you see me now?
Yes, perfectly clear now. How are you doing? How's your day going?
Very well.
Okay, so I'm going to do a brief introduction of Adeshegun because he's like, he's our person in Cassava. Well, right now, Adeshegun works as the group head for growth and marketing at Iwosan Investments. He is a corporate industry professional with sound experience building sustainable businesses and delivering growth strategy, communications, and marketing solutions for innovative brands. Basically, all the things I'm saying is that Adeshegun is a superstar, right? So he has successfully handled high-level and strategic business development duties at both clinical health, brand consulting, health insurance, health financing, and InsurTech. So you see why he is the perfect person to have this conversation with us today, right? Yeah, Shegun, welcome to Cassava Banter. I know this is your first time as a host. I know you usually join as a guest. I see you.
Yeah, I do.
Yeah, but today is your first time as a guest, and I'm looking forward to getting to understand the topic and doing a deep dive into health insurance. So before we go into it proper, I just want to give a brief background on the topic. I know that I got a lot of people saying, why did you choose to use DIY healthcare versus healthcare on the budget, right? So ideally, when people talk about DIY healthcare, people think about healthcare, self-medication, basically doing any sort of healthcare at home without the help of any sort of professional, right? And even though I know this is a very common thing, especially in this climate, a lot of people self-medicate a lot, right? most times it's not because they want to actually self-medicate. Most times you find out that the reason why is because they figured out that it's cheaper to do this, right? So just go into the pharmacy and tell the pharmacy, oh, I have a headache. Can I get paracetamol? Can I get Panadol? It's cheaper than going to the hospital, paying for a card, sitting down and waiting for a doctor to look at you, prescribe some drugs to you, which you still end up buying. Maybe prescribe some sort of test, which you have to pay for. So you see where I'm going with this. So a lot of people have now resorted to doing things at home or trying to self-medicate themselves if something is happening or if something is wrong with them. But I think in recent times we've gotten feedback, from health professionals who have said that, doing it yourself is not great. Maybe it might be good for, how's it called? First aid, when something is just happening. But when you start having serious ailments that, you need a health professional to actually look at you and be able to tell you, what's wrong with you and prescribe the best drug for you. So, and this topic is very, very sensitive for me because even as far as when I was a child, I remember if you just say, oh, I'm feeling feverish or something is wrong, the next thing somebody says is, go and take malaria drugs. They don't even know what's wrong with you. And then you go and take malaria drugs. It's very common here. So, but we've seen that that's not the best way for people to do it. And we now have things like health insurance coming here to sort of like, that's why I said healthcare on a budget, right? Because that's literally what health insurance is. You don't have to go through all of that process of having to, pay exorbitant fees just because you're trying to see a doctor or trying to get prescribed, with health insurance. But I know that some people still do not see the essence of it because I've spoken to a couple of people who say, but I only get sick once or twice in a year. Yeah, you do. But how much do you spend when you do eventually get sick, right? Compare it to what you're spending on a monthly premium for health insurance. It simply means that, you could save a lot more if you're doing this. So this is just the background on this topic. And this is why we thought it was very important. So I'll start with the first obvious question, which is, which I would hope that Shegun is going to answer for us today, which is, what is health insurance? What is it all about? Everybody talks about health insurance, HMO and this and that. So what exactly, in your own understanding, way that the audience will be able to understand, explain to us what health insurance is.
All right, thank you very much, Sadie. I think you've pretty much provided substantial context to the topic. And what I would also say is, I think we know more now than we probably did about 10 years ago. By we, I'm talking of us, the millennials and Gen Zs. So basically, health insurance, as we know it, in simple terms, is just the money you pay to more or less, cover your medical expenses, whether planned or unplanned, at any point. I mean, that's the simplest way to do it. Of course, you've heard about, many of us must have heard about car insurance, must have heard about property insurance, must have heard about any kind of thing. So the money you set aside, the money you give to, let's say, an intermediary to cover your healthcare costs or your healthcare expenditure later on, is basically just the simple description of health insurance. Now, this intermediary can be the HMO. I mean, HMO being Health Maintenance Organization. It's also used interchangeably with health insurance organization. So any money you set aside to safeguard your healthcare costs basically is the money that you have paid for health insurance. Now, that system, that's governance mechanism that ensures that this works, is pretty much health insurance on paper. So if anyone asks you on the road, what is health insurance? What you can easily tell them is that it's the money you set aside to take care of your medical costs later on. It's pretty much simple. So you can then go further to say, okay, the way it works, this can be done quarterly, this can be done biannually, this can be done annually. I mean, however way it works is entirely upon to you and the intermediary. But any funds you set aside to take care of your medical expenses, it's pretty much what health insurance entails.
Okay, I think that's pretty straightforward, to be honest. I don't think I would have explained it any better than you have explained it. However, I think another thing that most people used to ask is I remember when I was a little bit younger, when I just started working, basically, I knew people who had some sort of health insurance that their companies provided, and the feedback I usually get from most people as a then was that, oh, if you don't use your health insurance premium at the end of the year, you get something back. I don't know if it was everybody that was doing this, but there were a couple of people I remember very well, right? And so to them, it sort of became like a saving scheme instead of what it was actually supposed to be, which is a healthcare scheme. But nowadays I know that it's been broken down in such a way that it's easily very affordable for you to do. But Nigerians like that, gratuity. They want to get something back. And many people don't really see, going to the doctors as being something that they are getting back. They always ask. I get people ask me a lot. So if I am paying a health insurance premium for 2 years, I'm paying for 3 years, and I don't visit the hospital, what am I getting back? What I'm not getting anything back. So why should I pay for it? Right. So that's one of the things that I wanted to, see if you have any response, or if you have, clarifications that you can give people on, because I know that it's one of the most common questions that people ask, especially here in Nigeria. If I don't pay my, if I don't, if I keep paying my insurance and I don't use it, do I get something back? It's not like life insurance. It's different, right? So how would you, respond to this, or how would you say people should look at this when they're talking about paying the health premium?
All right, so that's a valid concern. I mean, anytime anybody mentions or hints at stuff like that, it's quite understandable, because you must also understand the pain it took them to even bring out money to pay for this thing. And then, as you rightly mentioned, Nigerians generally like to get value out of anything they commit their funds to. So if at the end of the cycle that your insurance is meant to cover, you don't get to use any kind of medical service, then it becomes a burden. You feel like you've lost money. I mean, I think same also applies to the people who do property insurance, car insurance. I mean, we've generally heard about people deliberately running into accidents just to reclaim car insurance, people deliberately
Right.
setting up their properties on fire just to claim some insurance on that. For healthcare, well, I haven't heard of anybody who deliberately put themselves in harm's way just so they could use health insurance. But so the interesting thing about health insurance is this. You see, basically it's a pool. It's a pool of funds put together by different persons from different places. So I can drop 1,000 naira for my health insurance. Someone in Gombe can drop his or hers, and then at the end of the day, you see that 36 persons, or 37, if you will, have dropped 1,000 naira each. Now, here's where it gets interesting. Chances are that at the end of that cycle, or during the course of that cycle, not every one of you is going to have course to use any healthcare service, if you will. And then what then happens is that, let's say only 10%, only 10 of you get to use it. What you might find out is that 10 persons alone might max out the entire fund that was paid. So you can use your family or an organization, for instance. Let's say you're a family of four, and then you pay 100,000 for health insurance. Chances are that it could be your partner, it could be your child who would use up the entire thing. And there is something that health insurers generally like to also watch out for. I mean, it's called the MLR. That's a medical loss ratio. So it's basically just I don't want to get too technical. It's basically just a function of how much you how much your healthcare expenses cost as a percentage of how much you actually paid for that healthcare expenditure. Of course, different insurers would have their maximum or minimum margins. And an interesting development in the health insurance sector that just happened, I think, a couple of weeks back. So I think it was Discovery. They announced something called Wealth Fund. So Wealth is spelled WELLTH, if I remember that spelling correctly. And what they did was they said, look, they have discovered that utilization rate has been quite low amongst their customers. So what that means is a lot of people paid for health insurance and they didn't get to use healthcare. So they now devised a means through which they can make you even go to the hospital for just about any reason. You can redeem points and stuff like that. So the long and short is it should not be seen as a waste of money if you don't get to use healthcare or if you don't get to use the hospital. And the truth is, whatever it is you think you have lost is not in any way any form of loss, because what you have also put into the pool has safeguarded or has cushioned the bills that someone else has incurred. Remember, I said it's a pool of funds. So
Yeah.
nobody wants to be the one that's, I guess, to use health insurance, but I'm sorry, I guess you use the hospital. But you see, at the end of the day, you never just can tell. I mean, you could think you're healthy and just any kind of mishap can happen. You can obey all kinds of fitness routines, you can adopt all kinds of safety mechanisms, and it could just be a very brazen injury that could knock the sails out of your knock the wind out of your sails. And at the end of the day, what you just want to ensure that you have done is that you have safeguarded yourself against that kind of unplanned expenditure. And that's the beauty of health insurance. So it is not in any way a waste of money. What you just need to do for that is to speak with your insurer, whichever organization it is, to ask what initiatives or what give back mechanisms or loyalty programs. I know a couple of Nigerian HMOs. Remember, I said HMOs, health insurance organizations or health maintenance organizations. A couple of them have different give back initiatives which customers can claim. So you need to have that conversation with your insurer to see what benefits might accrue in the events that you don't use your health insurance. I know a couple of private organizations tend to reimburse a particular percentage of unused claims made by an employee. You know, they deduct the insurance maybe from the employee's remuneration, and then at the end of the year or at the end of the cycle, they review the utilization rates and then they pay you a percentage back. So, I mean, I know different initiatives are peculiar to various organizations. So you just have to have two key important conversations, one with your insurer and the other perhaps with your employer. So that's pretty much how it works. Some organizations give you the health insurance for free, but
Yeah.
again, peculiarities.
I think I understand that. And to be honest, I relate very well with, when I first started working, I think my second job ever, I got health insurance. As I then, I to be honest, I just used to hear about health insurance because growing up, we sort of lived in my mom worked for a company that sort of provided all of these things, right? But it wasn't said out loud that this was health insurance. They just literally had a hospital. Everybody lived in the estate, so there was a hospital inside there. It was sort of like a self-sustaining city. So your hospital, your school, your market, your church, everything was inside there. So we literally didn't know to do anything. I've done like 2 or 3 surgeries in that hospital, and I didn't pay a dime. So I didn't really understand what health insurance was, not until I think my final year when I did my internship in the hospital. And I saw people, and then we had like files. Then we used to use files. It was a teaching hospital in New York, so we used to use files to get like patients' names and details. And then I saw some people's files had NHIS on it, and I kept asking, what's NHIS? And that's when I figured out that there was something like a health insurance scheme, for general, for people, right? And a lot of these people, when you realize that they couldn't even afford, these medical bills, they couldn't afford to pay. I think as a then maybe 500 naira, 1,000 naira to get like a file or something. And it's a teaching hospital, so most of these costs are very low. But there's still a lot of people who couldn't afford this. They would come with their kids, and some of them had NHIS, some of them did not have, and that was my first experience with health insurance. But then my second real experience was sometime in 2017 or 2018, where I had an illness. I was sick basically. My office gave me health insurance, and then I went to the hospital, and the doctor said that it's a major surgery. It's not a small surgery. Apparently, I had something called bronchitis, and they had to like expel stuff from me. So I had to do like a major surgery. So after everything, I was expecting that they were going to give me a bill. Maybe my health insurance didn't cover it, but I mean, literally, they just told me I was free to go home, and I was like, okay, what's the balance? And they said, no, your health insurance covered, So I was lucky. Um, that was my first ever personal experience. But since then, I don't think I've ever had to go to the hospital. The only thing I think I've ever paid for out of pocket is for my glasses, and that's because most times my lens changes maybe 3 times in a year or 4 times in a year. I have to go and do that myself. So I quite understand that, and I think your explanation was very self-explanatory. So now I'm moving on now to say self-care, right, is as a sort of like a form of healthcare. Is it enough for the everyday human being? Let me answer that first before I even go to your addition. So I am a big sucker for healthcare, self-care basically. I'm very minimalist. I believe that if you take care of yourself well, if you work out, you eat clean, you do all of these things, that you would be able to live a very comfortable life. However, even though I have been doing all of these things religiously, my whole life I have been doing all of these things, I still find out that, there's sometimes I'm literally sick and I cannot do anything. I need to go to the hospital. I can't say I would DIY myself out of such illnesses, right? Some time ago, I had like sepsis poisoning and I had to go to the hospital. Ordinarily, I'll just be at home and I'll drink my green tea and all of that. But I felt very differently, and I felt that, okay, I needed to go see the doctor. And I could do that because I could afford to do it because I have health care, right? Or I have health insurance that covers all of that. And I did that. But I know that for a lot of people, DIY is not because they want to do DIY, but because they can't afford really to not, do DIY or to go to the hospital. So it's now saying, is it enough for an everyday person? I would choose to say no, it's not enough. And this is simply because the world is changing, very rapidly. A lot of things are happening. With technology comes, there's a lot of the detriments to how fast we are evolving as a species, I would say, right? We've evolved, there is so much more, how will I call it, industrial production, that causes a lot of things that ordinarily would not have happened, and you can't help it. You can't really help it because these things is every day, from something as small as a toothpaste you use in the morning to the soap that you use. So all of these things will combine to sort of make it harder for you to say you want to use just self-care, as your health care. Except, I know a couple of people, maybe religiously, they believe that you're not supposed to go to the hospital, you're supposed to be able to take care of yourself, but even upon that, even those people, that sometimes you just have to go to the hospital. You can't help it. If you did anything concerning history in school, and talking about the death rates and birth rates that we used to have then, it was very, you'd hear so many stories about stillbirths or women dying in childbirth or stuff, all of this. And that's because they didn't have any access to like hospitals to use. Everything was done at home. So if there's a complication, nobody knows, nobody can see it because there are no machines, nothing, everybody's just doing it at home. So I don't think it is enough for an everyday human being to just, we're exposed to so many things. You go out, you're inhaling the exhaust from cars, you're hungry, you eat junk food that is mass produced. So a lot of these things play like a big role in making our health, like sort of deteriorating our health. And if you do not go to the professionals, people who actually know this work, this is what they studied, so they know the work. So it's not enough for you to say, oh, I'm doing self-care, so I don't want to have to go to the hospital. So I don't think it's necessarily enough for an everyday human being. Shegun, what do you think about doing self-care as a form of healthcare? for everyday
Yeah,
use.
very, very interesting point, Sadie. So the truth is, by virtue of our existence alone, nothing by itself is enough. Everybody needs some kind of pushing against everything, and nobody normally would genuinely believe that one single thing is enough. Even a believer would accept that prayers alone are not enough. It's not enough for you to be educated. It's not enough for you to be white or black. It's not enough for you to be anything. Whatever extras you can put to ensure that that state of health, is maintained is really key. Now, in the case of self-care, if you look at, well, I am not a medical doctor, but I would assume that all these various health tips that we read from time to time, okay, eat healthily, go to the gym, don't smoke, don't drink, don't this, don't that. Yeah, they are all part of self-care. Get enough sleep and the likes. But self-care is just, in my own opinion, one part of it. I mentioned earlier that unplanned or unforeseen eventualities can just happen. And
Yeah.
then boom, before you know it, you're lying on a gurney, or you're right in the hospital, and you just cannot help the situation. So at the end of the day, what you would discover is there is also, even if you feel that okay, you're well enough to not need any kind of surgery or anything, there's also something called preventive medicine, whereby you could just go to the hospital to have a regular checkup done. It could be anything. I mean, for people over the age of 45, I know the other day, Lagoon Hospitals was doing something regarding colonoscopy for those above the age of 45. And you would see that some of these routine screenings, some of these routine tests could literally point you in a direction that you never even knew existed. And you see, we've over time heard tragic news about the celebrities or even friends of ours who passed on due to terminal illnesses. Now, what you would discover is that most of this or some of these illnesses could have been discovered much earlier at a time when treatment interventions would have been more effective. So, if you look healthy, if you feel healthy, your gut instincts, unfortunately, are not medically admissible as proof of good health. Instead, what is going to justify that you are truly healthy is when you have some of these examinations done. And the examinations could range from just about anything. I mean, like I mentioned earlier, it could be colonoscopy, it could be general body wellness, it could be anything. And there are several organizations who are on hand to do this. And this still is where your health insurance also helps you. So, say for instance, you've paid for health insurance. And I think that's the second part of your question regarding affordability. Now, the truth is this: if you can afford to buy a smartphone, as long as it was not a gift, if you can afford to buy a smartphone, if you can afford to buy maybe an agbada, if you can afford to buy an ashwebi, if you can afford to buy anything considered luxury for someone of your own status or your earning capacity, be a perfume, it could be anything really, like I said, pair of shoes. If you can afford to buy any of these things, I strongly think you should set aside something for health insurance. And of course, really, you gave examples earlier on. In my own case, it wasn't even something I thought was serious until I went to the doctor and I was told, look, we have to get this thing out of you quickly, or else. This was in 2019, and then it was a major surgery. In fact, I had them record pictures, videos, and all of that. And at the end, I couldn't even believe my eyes. It was like, wow, this whole time, this is what I've been managing. In fact, so it didn't come in any kind of pain or anything. It was just I didn't even see any big deal about it. But curiosity got the better part of me, and this curiosity was just out of let me even use this my health insurance and see how far. And what was supposed to be a routine consultation set up a chain of different hospital visits, then the surgery, and it was really challenging. But one thing I was thankful for is when I saw the bill, I was grateful that I didn't have to pay a dime because well, my insurance already covered it. And then I think most recently in 2021, I went in for another surgery and still it was covered. So when you look at all of these things, I might have had to be crowdfunded to have the first surgery done. Looking at the bills and crowdfunded, maybe not on social media or anything, but you get the point. So
Yeah.
when you look at it, the self-care that I claimed I had done, the self-care wouldn't have prevented, fine, maybe the self-care would have prevented me from malaria and a couple of things, but there are just some, as humans, we are genetically predisposed to all kinds of diseases, which may or may not manifest at certain stages of our lives. So self-care definitely is not enough. And this is me encouraging you. If you have health insurance and you feel that, okay, you have not been sick, you have not gone anything, let curiosity drive you to the hospital and undergo a
So
comprehensive medical screening. Then see what, of course, this is not me wishing that anything will be discovered, but like I mentioned earlier, your gut instinct is not medically admissible evidence of proof of good health, a claim bill of health. What would actually justify or certify that is when you go through these routine checks that have been put in place. So that's what I think about it.
I agree completely. I think, in fact, I don't think that people should just stay and just believe that they are okay. I believe that, you should go for checks, even if it's once, you want to do it once a quarter or twice in a year, or 3 times in a year, however you want to do it. It's important that you go and check just to make sure that everything is fine. You're not praying that something bad is going to happen, but you just want to be sure. I just heard a story about someone who just realized that their dad, had some sort of blood clots. And he didn't know about this. It's obvious that this has been happening, but he didn't know because he hasn't really gone to the hospital, right? It was only when he got to a really bad points that they now literally took him to the hospital, and then we told that, oh, you have several blood clots, right? But they would have caught this thing earlier, and helped sort of like reduce it. So maybe give them some sort of blood thinners that would help to unclog it. But at this point, you just right now what you're doing is you're praying that nothing happens to him. But all of this could have been avoided if you do like a regular check. So it's very important. You can't even be telling yourself that, okay, if I'm paying this health insurance, yeah, I wouldn't just go to the hospital unless I'm sick. No, just like Chego said, just one day decide that you want to go to the hospital and just do a check. You're covered after all, so you don't get to pay anything off your pockets, right? You can just go and just check. But I think it's also very important that people put it, because another thing that I know that is an issue concerning this is that Nigerians don't really take our health very seriously. We are living on vibes, right? Our own health insurance is God forbid. But God forbid is not an insurance policy, right? It's not gonna save you if something happens, if you have an aneurysm or your appendix busted. That's not what you need to ensure that you're protecting yourself against any of these things, right? So that's important. So the next thing that we're going to talk about is the importance of health insurance in promoting healthcare. Now, when I was starting this conversation, I spoke about my experience with seeing people who cannot even afford healthcare, and so at the end of the day, they are stuck with doing the DIY, do yourself, at home. And it's not because they want to, but it's because they literally people have no, they say that they cannot afford to go to the hospital, and get a doctor to check them. But I know that that's what health insurance literally is here for, to ensure that you get these services or this health care, you get the health care without paying the astronomical value of that, the normal pricing, right? I know people who are paying for health insurance as low as 1,100 or 2,000 naira monthly. But you go to the hospital, you do 5 tests, you do 10 tests, you get drugs for all of that. You know that if you just want to visit the hospital once, the money you're paying for your yearly premium, you probably spend it at a go at the hospital. So, Adishago, if you can speak to us about the importance of health insurance in, sort of promoting healthcare, especially for us here in Nigeria, seeing that not a lot of people take their health seriously.
All right, thank you very much. So basically, I think healthcare, or let me say health insurance, is pretty much important and beneficial to every single segment of the value chain. And by value chain, I mean the consumers, that's ourselves, the healthcare providers, that's the hospitals, and then the health insurers generally. So those are like three key categories that I've identified. Now, for the individuals now, based on what we have said so far, I think you will agree that health insurance basically is a lifesaver, not just for you, for your family, for your pockets. Generally, it's just as important as any single thing that you spend money on. I mean, I can
Yeah.
assure you that no amount of money is as valuable or is as significant as whatever it is you've spent on your health, because you're without a functioning mind or a functioning body, you're as good as ineffective or unproductive. So for us as individuals or consumers, health insurance really helps to close that leakage that might be seen when we have to pay for healthcare, that I mean pay for a service that was unplanned basically. So just closing that leakage already helps you. It doesn't matter, you could be going on the road and then trip, you could hit your head over something and need a stitch, you could be involved in a it could be a fire incident, it could be anything. Just knowing full well that whatever it is, come rain, come sunshine, you're covered. That sense of fulfillment and that sense of financial security, I think those are two crucial things that every individual needs to consider, and to see why, or to see that truly health insurance is extremely key. Now, also for us, I think this one cuts across board. Generally, you would see that the health seeking habits of the average person around you. By around you, I'm using Lagos in particular. I mean, for those who might be staying in other states, it might be different. But the average person around you, just as you mentioned, just lives on vibes. I mean, whatever happens, happens. And right now, what we know is that life expectancy in Nigeria is just about the mid 50s. Whereas
Yeah.
there are some countries like Japan, Australia, a couple of them who have high life expectancy rates, like 89, as high as 90. So already, if you live to your 60, you've achieved a lot by Nigerian standards. But then
Yeah.
we know that things could actually be better, and you see, if our health seeking habits can improve, you know full well that number one, like I mentioned earlier, you can detect, or the hospitals or your doctor can detect diseases early and
Yeah.
start treatment interventions early enough, because that is usually when these treatment interventions are most effective. So imagine whereby you've secured health insurance for yourself. You know full well that at any point you can just walk into the facility and then have your checks done, and then boom, you can just take things up. And it could your house insurance can, it's the range is broad. For some, it might just be routine checks. Some would cover minor and intermediate surgeries. Some would cover complex surgeries. Your health insurance can be that broad. So health insurance generally would very much help to boost life expectancy rates, and in turn decrease the mortality rate, because we have one of the highest maternal mortality cases anywhere in the world right now. And you see, it's a function of both really. And then now for the hospitals, I had mentioned that there are three categories: for us ourselves, then the hospitals. You see, for the hospitals, every hospital needs what? Cash is king, right? And the money that the HMO is going to pay to you, or sorry, is going to pay to the hospital, is what the hospital is going to use to source drugs, consumables, and just about any other item needed to facilitate the delivery of care. So it's a funnel. You pay, the HMO pays the hospital, and then the hospital provides care to you. So that cycle can only be started with funds. Whether you are the one who is going to pay, whether it's going to be an organization, whether it's going to be sponsored, anything at all. So these hospitals, they also need these funds to be able to buy equipment, to be able to buy materials. I think if you know any hospital manager around you, you can just do a quick check and try and find out how much medical equipment or even drugs cost. It's a strong headache in the healthcare chain right now, the cost of sourcing these things. And we all know what the economic peculiarities of our country is. So it's really important for hospitals to also get that cash flow. And you see, in training personnel, I mean, you know full well that doctors, pharmacists, nurses, dentists, physios, radiographers, the whole lot of them, they require some kind of periodic or extensive training through which will basically help them hone their skills and be better at their craft. Now, if these hospitals are short on staff, I'm sorry, if they are short on customers being patients now, there is almost no way, nobody's going to train
Yeah.
medical students with dummies. It's going to be, of course, they're not using you as experiment or anything, but that knowledge transfer needs to happen. And that cannot happen when there is a shortage of footfalls. So footfalls in this case means visitations by patients or customers. Let me say customers, not to get too technical. And then, of course, for the health insurer now, that's the person or that's the intermediary that I mentioned, those who are ensuring that these hospitals are paid and those who ensure that you also get the best level of care possible. They also need more persons to come into the system so that perhaps they can broaden the coverage that they can give to you. So say for instance, your coverage only maybe five of you pool funds together and then you get health insurance. By the time they calculate, of course, they have actuarians who work with them who can basically analyze maybe disease patterns and stuff like that. They can project what can happen, not what can happen. Let me say they can do some kind of safe estimate of what might happen within that cycle when your insurance runs. And then they know that, okay, definitely we can't afford to add so and so service to this bouquet. Let's just stick with the safest option. That is because the pool of funds that they also have is quite low. So imagine, generally now it is said that less than 4% of Nigerians have health insurance. And we are a country of what? 2 million. Sorry, 200 million, or well over 200 million. So now let's assume that for those who are good at maths, I mean, 4% of 200 million is just about 8 million persons. Now, we know full well that more than about 130 million Nigerians are said to be living in abject poverty. Now, so let's have the 70 million from that 200 million. Those are the ones who are living above the poverty line. And we
Yeah.
have 8 million out of those 70 million covered. That leaves us with 72. And the question is, why are the 72 million not buying health insurance? By the time you do a quick survey as well, you see that a significant percentage of these 72 million persons have very nice gadgets. Could be a laptop, could be anything. A significant percentage of them have, I mean, everybody has the different things that they splurge on. But you see, healthcare spend is not necessarily going to be a splurge if it is done preventively or at the preventive stage. It becomes a splurge when you need it, like you're in dire straits, and then you have to cough out your entire belly to ensure that you pay. So the health insurers also need more persons to come into that pool so that they can broaden the services that they can give to just about anybody. I mean, the NHS is a classical model. You see a lot of English people grumble about the tax and what they have to pay for this and that. But what you would also find is they have, I mean, their coverage is in fact is overwhelming. You see, there are some problems, let me say, that can spur development. Now, when a lot of persons get to pay for health insurance, what that means is existing hospitals have to beef up their services or their operations just so they can contain. And then this can also present as opportunities for persons who might be looking to invest in healthcare and say, look, a lot of health insurance organizations are having a shortage of hospitals to send people to. Let's build more hospitals. And that's why you've been seeing increase in private sector investment in healthcare. So there's a bevy of benefits that can be seen, and it just goes to underscore just how important health insurance is. It benefits you as a consumer, it benefits the hospital as a provider of the service, and then it benefits the health insurance organization, which is the intermediary. So at the end of the day, everybody wins.
I forgot
So yeah,
I
okay, I can hear you now.
I forgot I was muted. Okay. So I think that for me, what I can even use to even explain this to more is somebody. I think I heard this from somewhere. Someone say you are literally one health scare away from bankruptcy, right? And literally that is it, right? You don't know what's gonna happen tomorrow, so why not take out that? I mean, if you can afford, like he said, like Shego said, if you can afford to do your Netflix, or subscribe for your DSTV, health insurance doesn't cost as much as most of these things, right? Most of they are literally micro health insurance plans that you could use, or even the regular plans also that don't cost as much as if you add your healthcare costs for the whole year. I'm pretty sure that it would not weigh when you compare it to other expenditures that you have in your life, which is why I'm a very, I literally, all my friends know, I always say it, get health insurance. And Shegun, something I picked up when you were talking also was about the percentage of people that use health insurance. So to be honest, it probably would have even been lower than that. I'm pretty sure the reason why it's even as high as that is because companies now offer health insurance to their staff. A lot of people don't have their own personal health insurance. They're literally on health insurance of those companies. So when they leave those companies, then they don't have any other thing to fall back on. Right. I personally, I like to be covered on all grounds. So not only do I have health insurance for my company, I also have a family health insurance that I do for myself, my parents, my siblings, and to be honest, if you're somebody who literally takes care of people, you notice that when it comes to healthcare costs, that's one of the biggest, the one that chops out of your pocket the most is healthcare, especially if you have like elderly parents and stuff, right? So today it could be arthritis, tomorrow, it could be something else. And these people, they are old, it's not their fault, right? So, but I realized that once I put them on a health plan, literally all my problems were solved. I don't hear things like, oh, I need to go to the hospital. They literally just go to the hospital because they know that they are covered, right? I only have to maybe pay if it's an exception or something very, spectacular. My mom did an eye surgery recently, and I didn't pay a dime. So those kind of things make me, it eases the burden for me personally. If you're somebody that you're trying to build some sort of, financial independence by yourself, why are you not costing healthcare into your expenditures? It should literally be there. It should be as easy as costing for groceries. If you say in a month you want to spend 100,000, 200,000 on groceries, what's wrong with spending 5,000 on a health insurance plan for the month? See? So, and a lot of companies do a monthly premium where you could just pay for month. It was then that I know that you wouldn't see a lot of people who do monthly. You see maybe quarterly, you see biannually, and all of that. But now it's very flexible. Literally, you could just pay it. If you want to even do it, you could just pay for the whole year. But then if you want to pay it in a way that you don't want to feel that money is leaving you could do it like on a monthly basis and you're covered basically. So it's almost a no-brainer at this point that everybody should at least have a health insurance plan. Now, basic health needs, right? These are when we say basic health needs, essentially things that we know is an everyday happening. I want to use one as an example. Malaria in Nigeria is a basic, it's something that you need to prepare for because you will get it one way or the other, right? You would get it. It's very rampant here. Malaria is something that at least you have to treat yourself in 3 months or 4 months. If not, when it's coming, you're breaking down. So that's just one example. So there's some things that you know that you should focus on, right? And then this then brings me to my next question. I have gotten a lot of questions from people who say things like, why can't they buy bespoke health insurance? So when I say bespoke, I mean literally picking what they want. So those basic things that are supposed to be the things that you're maybe you're predisposed to. For instance, I could use myself as an example. I am very predisposed to allergies from a lot of things. So if I'm putting anything in my healthcare plan, it will have to be something that has to be ENT. Very important for me, because I know that my allergies will always be something that will always keep coming, right? So if we're talking about basic health needs for people or for individuals, from my own point of view, what you should focus on are things that you know that you're already predisposed to. First of all, right? Secondly, things that you know that in your environment, you see a lot of people, that are falling to those kind of things. You should always prepare that. Even if it doesn't catch you, one day, you would get it. Not because you did anything wrong, but just because you're probably in that environment, stuff and all of that. And then another thing that I think people always, don't look out for when they're talking about basic health needs is physical well-being, right? Maybe because from primary school, I used to do like PE classes, and then I went to like a government school that was very focused on physical education. So I'd always known that being mentally or having a full-blown wealth of health, that's what I'm calling wealth of health, means that you need to be physically active, mentally. It has to do with everything. So before you even talk about your health itself, there is the physical part, there is the mental part, right? But a lot of people don't even look at this physical well-being. They literally just think that, if you just wake up in the morning, make sure that you eat food, you're not jonesing around, you drink enough water and all of that. And they don't do any sort of activities to sort of ensure that they are keeping themselves active. And what happens? They come to the office and they sit down for 8 hours. And then out of that 8 hours, maybe you stand for 1 or 2 hours, but you're sitting down and you're not doing anything to help yourself. Especially, let's use ourselves as an example. People in this Lagos, you sit in traffic for how many hours because you're going somewhere, and you come back and then you're eating that rice, or you're eating that food, or you're eating it, and you do that over and over and over and over again, and you don't ever think about, oh, maybe I should start working out, maybe it would be good to be in physical health. So I think personally that that's one thing that people overlook a lot. So if we're talking about the basic health needs, physical well-being is also part of the things that I would put in there, right? However, I'm very, I know that not a lot of health insurance would cover things like your gym subscription, but some people do. Some people do I think I know a plan that does a sort of tit for tat. So they tell you if your gym fee is, say 10K a month, would pay 7.5 for you and you make up the rest. Right? Some other people will pay 6 months for you, and then you pay the remaining 6 months of the year and all of this. But it's things that people don't even look out for. We did a poll last year of the things that people need or people think that they should add to their health insurance policy that will make it nice for them to, want to buy that insurance policy. And very few people picked gym. Very few. So people don't even take that as part of it. But I think personally that when you're talking about basic health needs, that's also something that should be focused on. Shegun, I would want you to chip in on this also.
All right. Yeah. I mean, these are very interesting. I think I can also see some interesting questions. So
Yes.
perhaps we might take them at some point too. So for basic health needs, I think as a standard, if you're looking to purchase any health insurance plan, basically you should have access to, let me say, apart from the marketing or the business development person who's going to engage you, there should also be the option for you to speak with a medical services manager of that HMO so that he or she can spell out the various benefits that are available to you. Now, in doing that, you also have to be sincere. So if, for instance, you know that you have a respiratory condition that has lingered, it could have, I mean, it could be genetic, anything. And then on your onboarding form, you didn't disclose this. You see, the house insurer basically uses the data you provide to map you to a pool. Now,
Yeah.
if for instance you didn't indicate any of these pre-existing conditions which you have, it could be a cardiac issue, it could be a hepatological issue, that's your liver, it could be anything really. And you don't disclose any of that just because you want to pay a smaller amount in health insurance. That's you more or less doing yourself a strong disservice. So what I always encourage people to do is go all out, be as honest as you can, because that would also influence the range of hospitals you will get access to. So I think really for this question in relation to those who are looking to purchase health insurance, I think the fundamental thing is, except of course you know how the scheme works, you know where the good hospitals are, you know generally how health insurance works, then you can make your demands. But I think HMOs are also honest enough to spell out the terms for you, provided you can also be honest with them, disclosing your real information, so they will let you know whether, I know a couple of them have partnerships with some gyms, so definitely that's an option you should you should choose. Because with gym, I think I always tell people, usually joining or starting a gym program or starting your gym subscription or whatever is usually hard, but you see the results are the things that keep you there. I mean,
Yeah.
you see transformation just by doing cardiac exercises, cardio every week in, week out. You can see changes. I mean, you breathe more efficiently now. You don't get tired so quickly. You don't, I mean, those are the little that I know. Of course, I'm not a medical doctor, I'm not a clinical personnel. So my knowledge on this is quite restricted. But I know for sure that there are several, I mean, there are some HMOs that would offer you spa sessions. It could be once a quarter, it could be once biannually, it could be anything really. But I think the onus lies on your preferred HMO provider to also run you through the details based on your own preferences and based on the pre-existing conditions that you have. Of course, someone who has maybe a congenital heart issue or a long-standing heart issue, the first recommendation that anybody or any HMO would provide would certainly not be the gym, because they would want to be quite careful about that. So it's a two-way thing. You do your own bits to be as explicit as you can, and then the HMOs in their own capacity would also, I would say, advise. So nothing really is basic as you might think. It just cuts across a lot of things, and it depends on how well you engage and how well you choose your preferred provider.
Yeah, so from what you said, it's just obviously it's a personal thing. So it differs from person to person. So what is basic for me may not end up being basic for you based on your own medical history and stuff, which is why it's always advisable to speak to a health professional when you're trying to buy any of these policies. Okay, so I'm going to take a couple of the questions in the comment section. So one person says, good afternoon and thank you for, this is an anonymous attendee, by the way. Good afternoon and thank you for the enlightenment. Please, I'm kind of a person that don't fall sick, but I wish to always go for checkups. How do I go about it? Shegun, do you want to take this or do you want to take it?
Yeah, sure. I mean, if it's normal to, I would assume that, I don't want to make any guesses regarding this person's age, but I would assume that you're probably less than 40-year-old. But you see, the truth is, I had mentioned earlier during this session that it is not unusual to not feel sick. And again, I'll just reemphasize a statement or a reference I made earlier on as well, that see, your gut instinct is not medically admissible proof. You need that documented evidence. So how you should go about it is, if you have health insurance, I think first things first, you should speak to your medical services manager or case manager, if you will. I know they have different names depending on the organization. Some call them client services managers. Whoever it is that is assigned to you in particular, I think that is the first person you should be having a conversation with. and let him or her know that you would like to go for a comprehensive checkup. It's really important. I mean, that's usually the first step. But if you do not have health insurance and then you want to just pretty much visit a hospital and get things done. I mean, there are several hospitals where this can be done. If you follow a couple of them on social media, they pretty much advertise their services and then let you know what you stand to get. So it's just you engaging, looking out. I mean, I would have been happy to recommend hospitals for you to go, but of course, for obvious reasons. But I think it's just important for you to pick one that is perhaps closest to you and one that is renowned to provide good standard of care. So you should go there and have a screening done. Of course, they would avail you the information or the results of this screening. Some might take a couple of days, some might be instant, but it's really important that you go there and speak with the attendants or the doctors and let them know what is needed. Of course, they'll run you through an entire loop. I mean, you go to the pharmacy, you go to the laboratory, you might need to see the diagnostics guys, I mean, all kinds of things. But it is usually smooth. An efficient system would ensure that your time is not wasted. Chances are in less than an hour, you're done with all of these things. So that's how I think you should go about it.
Yeah, definitely. I also think so. And I think it's a good step for you to say, oh, okay, you want to go to the hospital for checkups, even though you know you don't fall sick. So you're already being proactive, which is a good step. So either if you have an HMO, just speak to your HMO provider, or you speak to the hospital that you've been attached to, so you know the procedure for doing that. But I think it's pretty easy. These days you can literally just call the hospital and even book an appointment. So as easy as that, picking up your phone and just making a call, and you'll be able to, do whatever checkups you decide to do. And even if you do not have a health insurance policy, you can literally just walk in and also do that. So I'm gonna move on to another question that I saw. Okay, so this person says, hello Ralph. Ralph is one of our, we like to call him our seeder also, because he's literally been with us from the first episode of Insurance Matter that we've done, and he's literally always number one to join the call. So hi Ralph, good afternoon, thank you for joining today. So Ralph says that if a doctor gives me a wrong drug and I have health insurance, obviously, I'm sure that's what he meant. How do I know and what do I do? Thank you. Amazu, do you want to take that? Or...
Okay, so I think this is quite a delicate question, because when you say a doctor has given you the wrong drug, now what I assume is if you have a headache, a doctor or a honest medical professional will not give you an antihypertensive, for instance. I mean, you have a headache, they give you a painkiller. Now, if Panadol was prescribed and then on getting to the pharmacy it was discovered that is out of stock, of course, it is within the pharmacist's expertise to consult with the doctor and let him or her know that, okay, there are alternatives that also do the same thing. I mean, because right now, the diversity of the medical practice is that, no, I don't think any single drug is the only drug that solves a particular or that cures a particular ailment. There are always one or two alternatives or even more. So if that was not the case, if it was not a case of an alternative being provided, if you are convinced that it was the wrong drug, I think it's something you need to take up directly, either with your HMO if you have health insurance, or you seek second opinion. It could either be from the same hospital, it could be from another hospital. But it is not something to be taken lightly. But I think it's also important that you establish for sure what has happened. If an alternative was prescribed to you, I do not think that is out of line. But of course, I would expect that your practitioner should explain the discrepancies. If you also notice that this is different from what was written, you're within your rights, fully within your rights to ask questions of your doctor, of your pharmacist. So that's pretty much it.
Yeah, I think a lot of people don't know that you can ask your doctor questions. You can ask him, what are these drugs you're giving me? What are they supposed to do? Most people just take it hook, line, and sinker. If you ask questions, they're obliged to answer you whatever question you ask. So if you have this kind of situation, you can either confirm, like Shagun said, get a second opinion from somebody else just to make sure that you are not, being paranoid or anything. And then once you have ascertained that you were prescribed the wrong drug, there are different channels that you could use. You could literally either take it up with your HMO, or take it up with the hospital management. If you're scared that the hospital management might not do anything, then you go straight directly to, the insurance company that you're working with, or if you're doing it out of home, there are help boards that you can literally reach out to. So I don't think that's something that you should just take lightly, if you realize that it happened to you. Okay, so we have other questions here, but I'll take the old ones first. Said, okay, so which are the five leading HMOs in the industry? So,
Yeah.
yeah,
No,
so
no, it's an interesting. No, it's an interesting question. But you see, unfortunately, the results are pretty much speculative. We have a data shortage in Nigeria. You see, if you wanted to, for instance, search the largest HMOs, let's say in Europe, chances are that there might be a credible authority to verify that. So do not take my word for it. But what we know pretty much is by virtue of population. I know the guys at AXA Mansard are doing quite significantly well. I mean, I think they probably make up well over 30% of the health insurance market right now. I know they're closely followed by Hygieia as well, Hygieia HMO. I know that the guys at Total Health Trust are also there. So this is not me listing things chronologically. I'm just saying that this info is quite speculative, because even when you go to the NHIS website, which is a regulating body, even they did not state it there. And we know for sure that a lot of private companies, that's companies that are not publicly listed, do not readily release this information. So unlike banks, for instance, who will tell you number of subscribers they have, or telco companies who will tell you number of active subscribers, for healthcare, I know things are quite restricted. But I think the guys at AXA, Hygieia, and THT, they have a significant chunk of the market. Of course, there are some HMOs that do not accept or that do not cater to public lives. So these public lives basically just refers to the enrollees covered by the National Health Insurance Scheme. That's the NHIS. But then there are those who cover both the private individuals, that's corporate organizations, as well as NHIS staff. So I think that is also a key determinant of the population. But in terms of the biggest, that's by a release size. I mean, I do not know in terms of service provision or number of hospitals on their networks or anything. I can't speak to that. But in terms of, I'll say maybe general survey based on what we've heard, that's pretty much what we know. But of course, there are some who are more digitally savvy. I know the guys at Avon and Reliance are always out there doing stuff, doing adverts and the like. So again, there's really no verifiable data to justify this. What we know as of now is just speculative.
Yeah, same thing I would have said. Literally, we can't say, because anything you want to say now is probably going to be biased based on your own experience with those guys, right? So we can't say that they're like this. These are the people, the people whose names you hear every time, which I think Adishogun has mentioned, the AXA Mansard, the Hygieia, but there are a ton of other, health insurance companies that are scattered around the country. I even think it's even maybe this is a thing for maybe the NIA. I don't know. Maybe they would be the one to sort of pull this data together and say, okay, these are the list of the ones, and these are the top guys, or these are the ones doing well. Sort of like the way NUC provides an accreditation list for university. That's something that they could also do to also help individuals like us who want to find out all of these questions. So yeah, that would be what we can say for that. I hope we've answered that question for you, Gaspar. I think he had a follow-up question that said, what's the margin in the industry and the range of MLR?
Okay. So this is also largely speculative. You see, this usually is a function of utilization, like I said, and also I think it's strongly tied to the population you have. So if, for instance, HMOA has 5 enrollees, and then each one of those 5 pays 100,000 naira, the entire pool is 500,000. Now, or let me just use a round figure so that the math is easier. Let's say they have 10, and then each one of them pays 100,000 naira. The entire pool is 1 million. Now, for some HMOs, any MLR that exceeds 40 is already problematic. So I have only 10 persons in my pool, and then already they've spent 400,000 naira. I don't know what time, depending on the time of the year. If God help you, they utilize 400K worth of services maybe in the second month, and this is a 12-month cycle, then you know that you have your work cut out for you. But be it as it may, depending on your threshold, depending on your population size, if you probably do 40 for someone that covers just 10, that might be considered as good. Whereas if there's another person who has 20 enrollees that have, I beg your pardon, that have paid 100,000 naira each, that's a large pool of what, 2 million. And let's say the utilization for those ones is probably 50% or 60%. What you discover is that the guy who has done 60% MLR probably still has more funds to keep than the person who has done 40% on less funds. So it's really a game of numbers. There is really no maximum or minimum threshold. It's really just you understanding your own numbers and knowing what works. Some will tell you we can show that 60%, doesn't matter. Some will tell you once it exceeds even as low as 30, then it's a cause for concern. So there's really no standard. It's a function of your own business and a function of your own numbers.
Yeah, I think that's and Edushegun has really hit the nail on the head, because I think that it varies from organization to organization. You cannot really, especially as we have a data problem here in Nigeria, you cannot really say this is the number that we're going to be working with, right? So it's also very dependent on what organization that is. So I see that Ralph also asked another question, said some hospitals chosen by people for treatment use low active drugs to treat patient because it's health insurance. What can we do to ensure that such attitude be monitored to enable people get adequate health insurance benefits? Right.
Okay. So I think that's a very vital question. Of course, we've heard several comments from maybe Vox Pops where people have said there's some kind of discrepancy that happens towards, or that is shown towards, or some kind of discrimination rather that is shown towards health insurance beneficiaries. So I think that primarily is a concern that needs to be tabled before your health insurer. Now, let me say colloquially, it's often said that, okay, if your HMO doesn't pay the hospital enough, or doesn't pay the hospital on time, or they don't even pay at all, chances are that when you go to the hospital, you'll be discriminated against. As a patient, nobody should treat you shabbily. It doesn't matter whether anybody has paid anybody. You know you have paid for your service. So you deserve utmost respect. But then it is something you need to take strongly up with not just the hospital, but as well as your insurer. You need to let them know, you need to file a complaint. And I know that right now there are different channels through which complaints resolution is facilitated. You need to, first of all, file a complaint. It's not enough for you to grumble personally to yourself. That in itself doesn't really address the problem substantially. You need to also take things further by engaging your HMO and letting them know what has happened. In fact, the interesting thing is some of these HMOs have stiff penalties in play. I mean, there's something called money at risk, which some HMOs have with hospitals. So this money at risk is often a function of the hospital meeting key parameters that have been listed out for them. So if, let's say, patient satisfaction is an element on that money at risk model, chances are that the hospital is going to be penalized just for your own complaint alone if established that truly you were shabbily treated or you were disrespected. So the consumer is usually the most powerful stakeholder in the entire cycle. And that is what a lot of persons need to understand. Of course, they always say guest is God, customer is king, and all of that. In healthcare, that is, I mean, healthcare is like the one industry where that rule is most sacred. So you must kickstart that complaint resolution process by filing that your complaint and following up to ensure that this is done. Of course, I'm not saying this is the general case. I don't believe it is, but there have been instances where people have reported some form of discrimination from hospitals who
Yeah.
discover that they are health insurance beneficiaries. But it's extremely important that you file that report.
Okay, I think that's very clear, right? If you see something, say something, literally. Just go and talk to your health insurance partners about it. Just so you know what steps you need to take to ensure that this kind of things doesn't happen. Umar also has a question. I think a couple of questions actually. He says, I'm really impressed by your presentation. Thank you very much, Adam Umar. We said, indeed, a lot of people don't have much idea about how health insurance works and a lot of benefit that comes with it. So here are a few questions I'd like to ask. The first one, he says, what are the benefits of using a health insurance company? Right. Damaso, do you want to answer as I go so we can take
Yeah,
them one?
yeah, go ahead, go ahead. Okay, so the benefits. Well, I've mentioned it.
I
For
think you
for
said.
instance, the health insurance organization isn't going to come back to you and say, "Oh, we don't have money to pay for your healthcare," after you have paid them. So you have already outsourced whatever headaches you might have had, or you think you might have along the line by keeping your money with them. It's like a bank. So you don't give money to the bank and then when you need it, they start telling you, oh, we don't have money. They have to provide the money. So the fundamental benefit I would say is them ensuring that the money you have set aside for healthcare is used for the purpose intended. So that's like the fundamental thing. There are several other benefits, like I said, they'll come through for you when you need this service and all of that. But they would ensure that the money that you have set aside and they have put in their coffers for healthcare expenditure is going to be appropriately utilized. So that is the one key thing.
And to ensure that you get quality health care, at a very low cost, right?
Absolutely.
That's like one of the key. Okay, so his next question says, can one change his or her primary registered hospital to another due to relocation? Yeah, I think this is pretty.
Yeah, I think it's a function of the HMO themselves because there are some HMOs that enable roaming. I mean, roaming, as you know, means that I know there are some gyms right now. If you find yourself in Lagos, for instance, and then where you registered was actually Abuja, the roaming opportunity allows you to use the service in Lagos without any extra charge. So there are some HMOs that allow that that let me say interoperability, but then there are some who are strictly the hospital you choose is the one you use, except in the case of emergency, then you can use a second party but you have to notify them after 24 hours or 12 hours or 48 hours, be that as it may. But this is largely a function of the HMO. So you need to ask them whether they allow roaming.
Yeah, I think it's also very easy for you to, once you reach out to them, literally, this is, I think, is one thing that Nigerians shy away from. Reach out to these people. They are bound to respond to you. That's their job, right? So if you reach out to them and say, oh, I've just moved, I don't think anybody will be unreasonable to say, oh, if you were in Lagos and you chose an HMO in Lagos, you have to stick to that. If you've moved, then you've moved. So all they would just need to do is, if that access is not there for you to automatically change it yourself on your own HMO dashboard, they could literally just do it from the back end for you and, help you sort out whatever issues it is. So I think it's just for you to speak to the HMO that you're using, just to know if this is a feature that they added to their own products. Okay, the next question says, what is the condition of an individual registered with Cassava Health Insurance? Okay, leaving this, I think I will answer this question. So what is the condition of an individual registered with Cassava Health Insurance living in a society where none of the provided hospital by Cassava is in its core society? So that's a big issue, that because right now Cassava, in partnership with Smidan, is offering micro health insurance to a certain target audience, a certain target segment, which are the people who are registered under Smidan. However, some of these people, because they're in really, really remote areas, it's hard to get hospitals that are in their environment. What you get are maybe clinics, and when you are choosing hospitals that you want to partner with, you don't just want to partner with any hospital. You want to ensure that the hospital that you're partnering with is able to provide the kind of service that people would be able to benefit from. So that's why most times you see that there are no hospitals around you that your HMO is covering, probably because they don't meet up to the standard of what the HMO is doing, or maybe they are in cahoots with another HMO. But most of the issues that we've been having concerning this is that we have a lot of people who are in really remote areas that do not have access to hospitals at all. So what is close to them is maybe the federal medical centers, and you and I know that those people are literally not people on the HMO platform, maybe on NHIS, right? But on privately owned health insurance companies, most times do not partner with like what's it called, federal medical centers. So what we try to do is we try to bring in hospitals that meet up to the standard, that are at least close to you in or where you can travel to, or you could move to, say you want to go there to use their hospital. So we are still, obviously, this is something that is work in progress. We are obviously always looking out for more hospitals that we can partner with in places that we cannot. But most of the time, the reason why you don't see hospitals in your area on the list, is because maybe there are no hospitals there that are meeting up to the standard, or maybe they're not willing to partner with us to do this sort of HMO, what we're doing. But it's a work in progress. Like I said, we're always going to be adding. In fact, I think in the past maybe 2-3 months, we have updated hospital rates maybe 3-4 times, because we keep getting new hospitals who are coming on board, and so we keep updating the list, right? So we're just going to keep working until we're able to cover the people, because the people that are in those remote areas most times are even the ones that need this health insurance, right? So we're just going to keep working also with the healthcare providers also, to sort of bring that service close to you in such a way that you can have access to it whenever you want to. Okay, so I'll move on to the next question. It says, can I refer one to register with Cassava? Yes, of course, very much so. We are open to being referred by people, but for now, our micro health insurance plan is strictly for people who are registered under Smidan, because it's a partnership with Smidan, right? Smidan is a small and medium enterprise agency of Nigeria, basically, right? So if you have a business, if you own a small business and you're registered under Smidan, then you can access this micro health insurance that we're currently offering. So yes, please feel free to either come to our website. You can register via the Smidan website. Everybody who owns a Smidan number has access to register for this particular health insurance plan. So please feel free to refer if you want. And then he has a follow-up question. I think I saw it somewhere. Okay. Yeah, he says, what are the limitations of treatment to a beneficiary? Okay. What are the limitations to treatment to a beneficiary? So I'm guessing this is talking about insurance plans where you can add your beneficiaries under it. That would be my guess. That's what he's talking about. So I don't think there's necessarily any limitation. All I would say for those plans are that they will probably cost more than your regular plan because they are covering more than one person, right? So some people or some agencies, some health insurance agencies will tell you that, okay, if you're buying for 2 or 3 beneficiaries under you, you get a certain discount, based on the fact that you have a plan with them. Some people do not offer a beneficiary, you to add your beneficiary to your health insurance plan. So if you want to buy for your people, your family, you'd have to buy separate insurance plans for them. So generally, I don't think there are any limitations to treatment to beneficiaries, as long as your health insurance plan is a plan that covers your beneficiary also. I know that even some organizations give you a plan, and then some plan they say you can add a spouse and 2 kids. Some people don't have that, but some people do, right? But generally, I wouldn't think that there are any limitations to treatment of beneficiary. What do you think, Evan?
Yeah, absolutely not. So there might be HMOs who would list certain services as exclusions or on a TPA basis, that's third party agreements, or on co-pay basis, whereby you pay a certain percentage of the cost, and then they also pay a certain percentage. But usually most HMOs right now have made onboarding seamless. So if it's just you and you need to add an extra person, they can get their numbers across to you. By numbers, they'll do the math and let you know how much you are expected to pay. Some of them have actuarians who work with them, and these are the guys who help them crunch most of the numbers. So rest assured, it's expected to be a fluid process from what we
Yeah.
have seen, as long as you engage a notable provider of health insurance. So there's scarcely any limit.
Okay. I see here that he even says that he means level of treatment. So yeah, I think same thing. I don't think there is any limitation to the level of treatment. If one person is getting treated at a hospital, for something, it means that another person can also get treated for, it at that same hospital. Again, which I'd say that you need to confirm from your HMO to ensure that you have your beneficiary, you are allowed to add your beneficiary to your own health plan. Once they confirm that you are allowed to add your beneficiary, then I don't think there are any limitations to the level of treatment that you get. Everyone is supposed to get, ideally, in an ideal sense, an ideal world, everybody's supposed to get the same level of treatment. You're supposed to treat everybody the same because they are obviously paying for this service. So no, there are no limitations to that, as long as your health insurance policy covers beneficiary. All right, so we have more questions. So I'm just gonna pick them. Okay, this one says, thank you, Smithan, for facilitating the education on healthcare insurance. Right? Is it mandatory for employers to institute health insurance for staff? If yes, what's the minimum of staff strength to become mandatory? Adishagun, you want to take
Okay,
that?
so there's really no minimum. As long as you have someone in your employ, you should. And if you're familiar with the new act signed by the president sometime last year, I mean, what it basically requires is that all stakeholders have to be actively involved now. Whether you're a hospital, whether you're a healthcare, sorry, whether you're an organization, you have to be involved in this process. So it has been signed into law.
Yeah.
That's just what I am saying. It has been signed into law. So this is something that has taken effect basically. Of course, there will be defaulters, and it's up to us really as good citizens to point those out and report to the relevant authorities. But this has been signed into law. So yes, it is mandatory now.
Okay, great. Thank you. Kuya, I hope that answered your question. So another person, Isioma, says, can I ask my doctor that I want a comprehensive test without being sick and without him asking me to go for one, or without passing my boundary as a patient?
Oh, of course not. No, as a patient, I must say that you are well within your right to request for services. I mean, everybody, for instance, should be entitled to comprehensive medical screening. It's different if you just walk into the hospital and you say you want to do surgery. Of course, questions have to be asked. was surgery. Why do you think you want a surgery and all of that? But for a screening, because that is usually considered a major pillar of preventive medicine. So you are entitled to ask to to be rolled in for a comprehensive medical checkup. So you are
Yeah.
well within your right. Please ask.
Yeah. You're not crossing any boundary as a patient, to be honest, to ask for this.
Absolutely not.
So please still ask. Okay, so this person says I barely go for checkup, reason being that I don't usually fall sick. Now, the last time I went to my HMO for checkup, I was told that a particular treatment wasn't enabled. So I want to know why. Shagun, you want to take this?
So I'm assuming that this person went for checkup and then he or she tried to select what they wanted. You see, so now here's the interesting thing about checkups. Ignore whatever it is you've read somewhere or what you've read on what you've seen on YouTube or anything. Usually your doctor is expected to design or tailor what is going to work for you. Could be your doctor, could be your HMO, or I mean that's your medical services manager or your case manager. But really, there are standards that apply to comprehensive medical screenings. Now, you can have on the form, you can have a long list of maybe 50 items or 60 items. It doesn't necessarily mean that all 60 must be checklisted. There are some routine ones that just have to be done. I mean, your lipid profile, your blood sugar, antigen, antibodies, and all those bodies and stuff like that. There are some that are quite sacrosanct, and then there are some that are usually not relevant per se. I mean, for instance, if you are in your 20s, you may not necessarily need to do a colonoscopy, or you don't even really need to do a colonoscopy, that kind of thing. So there are some age-specific tests, and there are some that are quite broad. So I wouldn't want you to see it as something was rejected. But then if you are convinced that it was rejected, if you're an insurance policy holder, you should take this up with your HMO. And if not, you should seek alternative opinion. I mean, that's the beauty of healthcare or health insurance. You have the liberty to ask for second opinion if you're not convinced of a service or a response you got. So that's really it.
Okay, so that's literally it. If you go for a checkup and then the doctor says that the particular treatment wasn't enabled, it could be that maybe it's not necessary for you, right? Or maybe your plan doesn't cover that. But these are all things that you can confirm when you speak to your health insurance, partner, and you can sort this out immediately. Okay, the next person says I joined in late and I'm not sure if this has been touched. However, I'd like to know what should be the steps to choosing a good HMO. I think this was touched, but you can just go
Yeah,
over it.
so I think the first thing would always be reviews or feedback, peer reviews. I mean, ask around what is being said about the organization, because what is being said or was said by someone who you might eventually be. So it's usually, the reviews are mostly experiential. So they are usually left by persons who have had to use the services. I'm not saying you should get carried away by what is put on social media pages or anything. I think you also, if you have the opportunity, you should visit these hospitals if it is in close proximity to your place of work or your place of abode. You should visit just to see how things are. But I think a standard organization, a modern healthcare, a modern hospital should have a substantial amount of information available on their website. I mean, if I go to a couple of websites now, I know for sure that I can get critical information. I mean, I'll use a classical example. If I go to Lagoon Hospital's website, I can see the list of consultants, I can see the list of services available, I can literally call basically from the website, I can send emails almost directly. So there are some standards that have to be upheld. So when you visit when you want to profile some HMOs, it's also important you maybe go start from their website or maybe their social media page, just to see the quality of information, the amount of information being put out. And you should also see what people are saying about them. Are they regularly, or do they regularly get plaudits from persons, or do they regularly get derogatory comments? I mean, I know banks would not be good examples to use in this case because everybody seems to not be happy with banks with the cash crunch. I don't want to use them, so I'll stick with hospitals. But the same applies to health insurance organizations or HMOs. Ask around, get feedback, and then you can also maybe schedule a brief visit to their offices just to see how they run things, or ask to speak with a representative, because usually that is the first impression you get about that organization. Just by speaking to the call center representative might or may not tell you what you need to know. But critically, I would start with reviews.
Yeah, I think that's pretty straightforward, right? We're in an era of digital transformation. Literally, this information is there if you want it. You just need to go and find the information, right? Ask people. They say word of mouth is very good. So ask people, ask your friends, ask your family. I'm sure people have information about health insurance and their experience using them. So it should be easy for you to then make a decision based on that once you've done all of this research. The next question says, how can I know the HMOs that covers federal hospitals? So yeah, Shegun, if I go on.
I mean, again, there are some HMOs that have their provider networks listed on their website. This still speaks to the quality of information that these people are thoughtful enough to put out. So if you go on their website, there are some HMOs that list out their provider networks. And then there are some whom you have to probably send an email to or put a phone across to find out these things. Either way works, but I am not sure whether it is common practice for HMOs to list a lot of federal hospitals. And that is because, with federal hospitals, you have a lot of persons trooping there and all of whatnot. But you as the HMO partner or the HMO beneficiary or the HMO customer, what the HMOs also try to do is to give you some kind of sense of exclusivity. And that's why majority, or well over 90% of their provider networks are private hospitals. So I do not know those who have federal hospitals listed. I know a couple of them do, but you can go on their websites to see who has provider networks listed, and that should give you the information you need. Or you can put a call across or send an email.
I think another reason why you might not see a lot of this is because most federal hospitals are teaching hospitals, right? So there are hospitals where your doctors are going to go and get trained. And then most of them are under the NHIS, right? So maybe they might not be under your regular health insurance scheme, but maybe the federal health insurance scheme, that's what they'll be under. And because they are federal hospitals, they almost charge almost next to nothing. Their charges are very, very low because it's strictly funded by the federal government, right? So that's why you see most of the times they would not necessarily be under designated HMO. Some of them might be, right? But because some of them are streamlined to being teaching hospitals where they train people and all of that, might not necessarily want to be under them. But excuse me. It's easy to confirm all of these things. Just go to your HMO's website. They should have a list of the hospitals, or you even go to the hospital's website. They should have a list of the HMO that they partner with on their own website too. So yeah, that should answer your question, Kelvin. This last person says, I went to my assigned hospital and I was told I couldn't get checked for my eyes and prostate. When I inquired, I was told my policy doesn't cover that much. At what subscription do I get covered for such? Okay, I think I can answer this one. So I think when Adishagun was talking, he spoke about how, different pricing could cover different things. You'd get different if you want to get health insurance quotes, and by the time you talk to a specialist or talk to somebody, consultant, and you explain to them what you're predisposed to, they would suggest the best plan for you. Usually this plan takes into cognitive your current health status, right? It takes into cognizance what you've gone through before, any sort of health crisis. So all of this have been put. So it's either number one, maybe you are getting a plan that is not, I would say, not robust enough to cover all of these things, right? And so what you need to do is, it's not a big issue. All you simply need to do is just speak to your HMO, and explain to them that you want a plan that is broader and that can cover things that have to do with this, right? They can now suggest a plan that would probably cover something that is probably not covered in the one that you're currently working on. So this is why Segun was talking about speaking to somebody before you buy a plan. It's very important that you speak to somebody, speak to a consultant, that the HMO, let the person know what kind of health issues that you have, that you're predisposed to. That way they can suggest the plan that is going to be best for you. Segun, do you have anything to add to that?
No, nothing at all. You've pretty much covered it in detail.
Okay, great. So I think we're done with all the questions now. And this was a very great session. Thank you so much, Adishegun, for giving us your time. Thank you for coming on Insurance Banter, our first episode for 2023. And thank you for everyone who has joined. Please, if you ask any question that has to do with Cassava's product itself, I have already reached out to a couple of people to send in their information, and somebody will reach out to you. For those of you who had already dropped your information, be rest assured that you will get reached out to by somebody from our customer experience team, and they will try to help you to sort out your issue. Again, our mantra here at the brand is that you should enjoy insurance, enjoy your life, sort out, protect all of these things so that you can leave all of that, focus on living while we focus on providing you coverage for the things that you love, right? And then at the end of the day, you'd find a way to enjoy insurance as a whole. So thank you very much. For those people who joined late, this webinar is on demand. You can go to our website or our social media page and you see a link there for Insurance Banter. You can just click on the link and it will take you to a place where you can rewatch it, just in case you want to come back to some of the things that we spoke about in this session. Our next session is going to be coming next month, and we're going to try and do something different for our next session. So please, keep your eye open for our invites, because we know that some people here have been joining us from the beginning. So we appreciate that, and we just want to say thank you. Thank you very much, Segun, for this session. This was very insightful.
My pleasure. Thank you for having me.
All right. Thank you, everyone. Have a great day.